Good evening, Pro-Life America. This is John Williamson broadcasting from high up in the heart of Havertown, Pennsylvania. Co-host tonight is Charlie DeFeo. Charlie, how are you?
Doing great, John. It's great to be back on Pro-Life America Radio.
Thank you, Charlie. Why don't you say a prayer for us tonight? I want to pray for some people specifically. Of course, Bob Cassidy and Patrick Henry. My good friend Phil Farley. I'd like you to pray for all those hurricane victims, all those fire victims, and all the preborn babies in America.
You got it, John. And let's not forget the Christians being persecuted throughout the world, especially the Middle East also. So let's begin, as we do with everything, with prayer in the name of the Father, and the Son, and the Holy Spirit. Amen. St. Michael, the Archangel, defend us in battle. Be our defense against the wickedness and snares of the devil. May God rebuke him, we humbly pray. And do thou, O Prince of the heavenly hosts, by the power of God, thrust into hell Satan and all evil spirits who wander through the world, seeking the ruin of souls. Amen.
Thank you, Charlie. We also have our co-host Bernie Long is in the house, and you might be hearing from him tonight. Our show is called Pro-Life America Radio, and we'll be coming to you every Thursday night at 7 o'clock p.m., so contact your friends and your family via email and let them know how to tune in. We're now on Facebook. We also are on Twitter. We also have a website at prolifeamericaradio.com. So if you missed the live show, you can tune in at any time, as every show is taped and placed in the archives. We have a few commercials before we get started, before we get with our guest, Dr. John Travaline, and I call her Dr. Louise Mitchell, but I understand she's not a doctor yet, but very, very soon. So those are our guests tonight. But a few commercials. Number one, we just had Johnny's Run for Life last weekend, and it was quite successful. We got over $20,000 raised, and we will save 80 children with that money. I've got another $1,000 check that came in today, so we're probably up to $21,000 in that event. Also, this coming weekend, the Mother's Home Golf Tournament takes place. So if you're interested in golfing this weekend for a good cause, the Mother's Home in Darby, Pennsylvania, dial 610-583-HOME, HOME. 610-583-HOME, and sign up to golf for the Mother's Home. I also have some information that today in the organization 40 Days for Life, there were 2 saves down at 12th and Locust. 2 mothers walked away from the abortion clinic today at 12th and Locust. So congratulations to all those people down there at 12th and Locust who were praying in front in the 40 Days for Life organization. Now I'd like to introduce my good friend Charlie DeFeo, the young author, who has a few more commercials for us. Charlie?
Thank you, John. I actually, at the outset, I should not have forgotten to invoke Our Lady of Fatima. Pray for us tomorrow. Friday, October 13th, we've been celebrating all year the 100th anniversary of Our Lady of Fatima, and tomorrow represents the miracle of the sun, October 13th, 1917. We will have a big event Saturday, 2 days from now, in Westchester at St. Maximilian Kolbe Parish. Our Lady of Fatima at 100 years old. The website is Fatima100conference.org. So that's Fatima 100, Fatima100conference.org. You can show up and just pay there. It's $30 for adults, $20 for children. It's going to be a wonderful day, 8 a.m. to 3 p.m. The website has all the details, including directions. We are going to have international Catholic evangelists speaking, most notably Paul Kenger, who wrote the book A Pope and a President, the relationship between Pope John Paul II and Ronald Reagan. And Paul Kenger is a Ronald Reagan historian. Our friend Christopher West will be speaking, and Dr. Ralph Martin, and Brian Gale, and Michael McMonigal as well. So please come this Saturday, October 14th, 8 a.m. Starts with 8 a.m. Mass, and then the speakers and the rest of the festivities will go on, and it will end at 3 p.m. This Saturday, October 14th, Fatima100conference.org. The the Fatima 100 event this Saturday at St. Maximilian Colby Parish in Westchester. And the directions and all the details are on the site. But also, John, if anybody does want to contact us we have two very special guests, and I know our topic tonight is going to be very interesting. Please, you can call or text at 610-306-9532, 610-306-9532. We'd love to hear from you. And I'd also like to share with our listeners, there was some news out today about pro-life. The Washington Post wrote an article, "Is the United States one of 7 countries that allow elective abortions after 20 weeks?" So that headline to me is a little misleading because it's an emphatic yes, and they do admit that later in the article. And this was also confirmed. The Susan B. Anthony list has actually a graph. The United States is one of only 7 countries that allow elective abortions past 5 months. And there's an interview with Lila Rose. When are we going to have her on the show, John? Lila Rose.
As soon as you get her on here. I'd love to have her on there.
So Lila Rose was interviewed on Fox News. Twitter is censoring pro-life message. Even Facebook came out and said that's wrong. They shouldn't do that. So I want to encourage our listeners, go to my Facebook page. It's all posted there, and share this. 2 of John's 6 points are educate yourself and educate others. John, I listen to the show every week. Did you know that when I'm not on it?
I do. I do know that.
And I've educated myself from the show. So we need to educate ourselves and educate others, and I'm going to ask our listening audience to go to my Facebook page right now or whenever you can to find these articles and share them with your world in social media. So go to Chaz DeFeo, C-H-A-S, like Sam, capital D-E, capital F-E-O, and at the top, right underneath the advertisement for Pro-Life America Radio, John, are these articles. So just scroll down and you'll see them, and you can just hit share and share them. Read them yourself to educate yourself, and then share them with others. Now, I would also, John, like to introduce our 2 guests before you take it away. Our first guest, actually, is Professor Louise Mitchell from University of Mary. Louise is also the Vice President of the St. Catherine of Siena chapter of the Lay Fraternities of St. Dominic here in Philadelphia, of which I am a member. So I've been blessed really to know Louise, and she's educated me a lot in our faith over the last 3.5 years. So Louise teaches at University of Mary, and she'll talk more about what she does. It's ethics related. And our other guest is Dr. John Travaline, who is an MD and also a deacon. Wow. So I want to hear more, can't wait to hear more about that, John. And
Same here.
The doctor actually where he works he's from Temple Hospital, and he actually gets to work with those at end of life. So I'm really excited to hear tonight's show, John, and hear what our guests have to say about all this.
Oh, well, thank you, Charlie. Well, then let's talk to our good friend Louise first. And I advertise her as being a doctor, but she tells me she has a few more weeks to go before she becomes a doctor. And I understand that you went to St. Joseph's School for grammar school. We always like to hear that saint on the front of the school. And then you went to Bishop Eustace.
Good prep school, Catholic.
Very good. Everybody in this room, other than you and the good physician, went to Cardinal O'Hara High School. So I don't know if we can forgive you for going to another Catholic school. And then you went on to the St. Louis University. And what kind of a university is that?
It's Jesuit.
Jesuit.
Yes.
Okay. One of the good Jesuits?
We would hope so.
Good.
I had a good time while I was there, and I thought I had a good education from them.
Well, you're here today, so you must have had a pretty good education, right?
Yes.
And then you got a BA there, and then you went on to University of Dallas, right?
Yes, I got a Master's of Theological Studies there, and that was a very excellent program.
And that school is in the heart of Southern Baptist country.
Yes.
And it's a Catholic school. I just learned that tonight.
Yes, it is.
Very nice. And you got a degree in moral theology from the University of Texas, or what? I mean, from the University of Dallas.
It was a Master of Theological Studies, so
Okay.
we studied Vatican II, the Catechism, the Bible.
Right. And then you have an MA in moral theology also?
Yes, from Ave Maria University in Florida.
Now you're talking. Okay, we knew that's a good place.
Yes, that one's a good one.
Yeah, and that place was started by the founder of Domino's Pizza, right?
Yes, Tom Monahan.
Okay, a good Catholic, right?
Yes.
Okay. And do you have any more education after that?
Yes, for the last, I don't know how many years, I've been working on a PhD in bioethics from the John Paul II Institute in Melbourne, Australia. Long distance, obviously, and writing my dissertation on metaphysics, anthropology, virtues, and the Christian physician.
Wow.
Hopefully, I will finish in the next year or so.
All right. Well, before I get into anything else, I'm looking at your book, Catholic Witness in Healthcare, edited by John M. Traveline and Louise A. Mitchell. That you're very familiar with that book, right?
I hope so. We spent years on it.
Wonderful. Just tell us real quickly, what is that book about?
Well, in my teaching at University of Mary, I looked for a book in Catholic clinical medicine, clinical ethics, for my students. And I was not able to find anything like this book. There are secular clinical ethics books, there are Catholic bioethics books, but not Catholic clinical ethics. And that's what this book is. We got physicians from the Catholic Medical Association and others to talk about how they practice their Catholic faith in their practice of medicine. And it covers many different topics from beginning of life to the end of life.
Is this a book that is more for a physician or for a regular guy like me?
Our main audience is medical students, but I'm sure there is plenty in it to interest the average person also.
Very good. Well, let me talk to our new good friend, Dr. John Traveline, and ask you a little bit about yourself, Doctor. Welcome to the show, by the way.
Thank you, John. It's a pleasure to be here.
Thank you. So I understand you went to Norwood Academy, which I thought was just some run-of-the-mill, public school. But
No,
you're telling me that's
no. I assure you, Catholic school run by the Sisters of St. Joseph.
Very good.
Still to this day in Chestnut Hill, part
Okay.
of Philadelphia.
very nice. And then you went on to Malvern Prep, right?
Yes.
And that's what's that famous battle that's at that Malvern's on the site of
the Paoli Massacre.
Paoli Massacre.
The Paoli Massacre, right.
Right.
Yes.
And
Used to run up along there.
Okay.
There's a
And-
monument there and everything, yeah.
And who's that guy
So-
from Paoli that who brought his men there and got him massacred? Mad Anthony Wayne.
Yes.
Right.
That's right.
Interesting. So after you left the site of the Paoli Massacre, then you went to a Catholic school in the city of Philadelphia.
I did. But let me just, no saint prefixes Malvern, but as you may know, Malvern is a Catholic preparatory school run by the Augustinian
That's
fathers.
what I was going to say. St.
Yeah.
Augustine.
Yes, yes. And it was there too that I was well formed in those formative high school years.
Mhm.
But then, yes, went then after Malvern to St. Joseph's University here in Philadelphia.
Okay. Is that a Catholic school? I forget.
That is, it is a Jesuit university.
But I said, is it a Catholic school?
It is a Catholic school.
Okay, very good.
Yes.
All right, and then you went on and you got a medical degree from Jefferson.
So after St. Joseph's, graduated there in '84, went to Jefferson Medical College, was its name at the time, Jefferson Medical College,
Mm-hmm.
and studied medicine there 4 years. I mentioned earlier, John, off air, that coincident with that, I took graduate studies at Villanova University.
Mhm.
Again, couldn't get away from the Augustinians.
Very
knew
good.
Well,
the interesting thing was that you're going to medical school at the same time you're going to Villanova getting
Yeah,
religious studies?
after the first year of medical school, I couldn't pass up. Villanova was advertising at the time for their graduate program in religious studies that, believe it or not, even back then, it was $60 per credit. I just simply couldn't, but my interest in theology and religious studies and Christian ethics drew me there. So I would take one or two classes at evening, travel up from Jefferson on the R5 to Villanova, and then summers would take a few classes there as well.
So do you consider yourself a Jesuit or an Augustinian?
I think I ally more with Augustinian.
That's what I
would
thought.
say, yeah.
Very good.
Yeah.
Okay, so you got out of Jefferson. You're going to Temple or at Villanova at the same time, and then you obviously completed your studies at Jefferson, became a physician, and you got some further education from there.
So what happens after medical school are graduates will go into training programs, particular disciplines. I trained in internal medicine at the University of Maryland in Baltimore. That was a 3-year program in internal medicine. And then following that, came back to Philadelphia for additional training in pulmonary medicine and critical care medicine. And that's when I arrived at Temple Hospital for that last leg of my training.
And you're still there, though.
And then after I finished that, the way things were working with research that I was doing at the time and things in our department there, it made sense for me to stay on. I was asked to join the faculty there and did so, and have been there since on the faculty of Temple.
Well, you must have some more education because I think you're a deacon.
I am a deacon. I was ordained in 2012 here in Philadelphia. And as part of the program then, back then, it was about a 6-year part-time program at St. Charles Seminary is where we had class and formation. As I said, was ordained in 2012.
Oh, very nice. So there we have it. We have two well-educated people. I just want to put in my 2 cents here. I graduated from Westchester. I hated college, and I got a degree in economics from Westchester in 3 years. I hated college so much I sped it up instead of dropping out. And then I went to law school 6 weeks later. At the age of 23, I graduated, and I said to myself, geez, I'm going to get some more education after this. Zero education after that. Oh, at the School of Hard Knocks, maybe. That's about it after that. But anyway, let's go right to the main reason you're here tonight. This is the Pro-Life Show. What's the name of our show? Radio Pro-Life America, right, Charlie?
Pro-Life America Radio, John.
Either way, it works both ways, Charlie. So you can have radioprolifeamerica.com or prolifeamericaradio.com. Gets to the site either way. But you're right, we should put pro-life first. And then what people will be looking for us. But anyway, let's go right to the main reason you're here is end-of-life issues. And you're here because you are very good Catholics, I am sure. We got an Augustinian and a Dominican, right? How can we beat that, right? St. Dominic and St. Augustine. And really what we want to hear, and we've been advertising this all week, end-of-life issues. What does the Catholic Church say about what we should be doing towards the end of our life as far as ordinary care, extraordinary care, food and water, and that type of thing? And I'm going to ask whoever wants to go first on this one. Okay.
Okay, John. I since you brought up a few very technical terms of ordinary care and extraordinary care, I'll try to make a few comments about that. Because they are very technical terms in moral philosophy, Catholic moral theology. Ordinary care, sometimes also referred to as proportionate care, are treatments that may be applied to a patient that, as is said, are morally obligatory. These are treatments that a patient in certain circumstances for which these treatments would be recommended, that person is morally obliged to undertake, to accept. Extraordinary care, sometimes referred to as disproportionate care, extraordinary, disproportionate, moral theologians will, and ethicists will speak of that as morally optional. Therapies that a patient may opt for or not, and to opt out of, for example, would be very appropriate in particular circumstances. So ordinary or proportionate care, think of as morally obligatory, extraordinary or disproportionate care, morally optional.
Okay. Well, why don't you give us, and I know you were about to say this anyway, give us an example, some examples of ordinary proportionate care and some examples of disproportionate extraordinary care.
So I often will teach the students and others in this area that there's not a list of therapies that are always ordinary or always extraordinary. A particular therapy, for example, dialysis, kidney dialysis, in many circumstances is ordinary care for a patient. But sometimes, again, given the circumstances of an individual patient in a situation, may become extraordinary. And a number of other examples of medical therapies, mechanical ventilation, antibiotics, any of a number of other medicinal therapies may be ordinary, or typically ordinary, but may be extraordinary, depending upon the circumstances. One particular therapy or treatment in medicine is medically assisted nutrition and hydration. And this has gotten a lot of attention in recent years surrounding, most recently, Terry Schiavo case that got worldwide attention, where medically assisted nutrition applied to a patient via a feeding tube and hydration, medically applied, was in the consideration for whether it was considered morally optional or disproportionate or extraordinary care. And people on the, quote, wrong side of this debate, saying that it was morally optional, therefore would say, and did say, that someone in a state of permanent unconsciousness, there's no obligation morally to feed them, to provide them with nutrition and hydration. As I said, this was the morally illicit form, the wrong side of the debate. But this was a very prominent matter for quite some time, and it was our late pontiff, St. John Paul II, that then very prominently spoke out about this particular issue of medically assisted nutrition and hydration in the circumstance, and announced that, consistent with Catholic moral tradition for hundreds of years prior, that medically assisted nutrition and hydration is ordinary, i.e. morally obligatory care, and ought to be provided on that basis. It was not an option for someone to just discontinue medically assisted nutrition and hydration.
Now, Bobby Schindler was on our show in the last month, and he, of course, is the brother of Terry Schiavo. But I remember seeing pictures of Terry Schiavo, video of her, and she did not look like she was unconscious to me. Did you see those videos?
Yes,
you know?
yes, of course. Her eyes were open, some tracking at times.
Right.
She was the best, I think, medically to describe as in a state of permanent or minimally responsive state.
Mm-hmm. So she wasn't.
She was not in coma.
Right.
She was not in coma. Her eyes were open.
Well, and I guess for the audience, in that situation, the judge decided that since the husband wanted her not to have food and water, he decided that she should not have food and water, and actually put an armed guard outside her room to make sure that her parents or her brother or anyone that was visiting her was not bringing her any food and water. A terrible situation, in my opinion. Well, let's go over to Louise and ask you about that. You know, this is from the medical perspective. Can you tell us about that same situation about Terry Schiavo from an ethical perspective? In other words, it's probably the same thing, but can you tell us anything about that?
One thing as Catholics that we're supposed to do is approach death with our eyes wide open as such. We're rational beings, and we are supposed to prepare ourselves to meet our Maker. Terry Schiavo being in a minimally conscious state, we would want her to have whatever opportunities she can to meet her Maker consciously. And so we wouldn't want to say sedate her or anything like that if she's not in any pain. And for anyone, even who are in normal and not minimally conscious but aware, we would want to be awake and aware and prepare ourselves to meet our Maker. And Pope Pius XII was given a question about whether it would be okay to sedate someone toward the end of life. And he said, yes, it's certainly okay to manage pain, but optimally it would be good to be conscious and to be preparing ourselves. Doesn't mean that we have to tolerate pain or be suffering, not at all. So if we needed medication to do some kind of sedation to handle pain, that is perfectly fine.
Mm-hmm. I remember my father passed away about 20 years ago, and he was dying of bladder cancer, and you know, you could just watch his last 7 days of his life. You know, they just stepped down every day. But at that time, my mother was advised that morphine, which she had a script for, would hasten death. And so as soon as she realized that, she stopped giving my father morphine. Can I ask the doctor what he thinks about that, about giving something like morphine, which I guess slows down your respiratory rate, I assume?
Yeah, morphine is a wonderful drug,
Mm-hmm.
and we thank God for morphine and other drugs like that. It's a very effective analgesic. That is a medicine that will take away pain for someone in pain. It's a beautiful, very useful drug. With regard to hastening death, again, we need to consider the circumstances of a patient. So let's take your dad, who, as you said, was in pain at the end of life, and morphine, again, a very good drug for pain management. The intention in this, again, getting into sort of the moral analysis or the ethical analysis of these situations of hastening death, applying certain treatments, in this case morphine, your dad in pain or anyone in pain, it is very appropriate, and in fact, the proper thing to do is to alleviate the pain. This is good medicine, it's good care for a patient. So administering morphine with the intention of alleviating the person's pain, very appropriate. It is true that there are side effects, like with any drug, that morphine, opiate, analgesics in that class may reduce respiratory drive, may dampen a person's breathing drive. And while that's true, we're in medicine, as we apply a drug like morphine, we're giving it with the intention of relieving the person's pain and making them feel better, and not giving it with the intention of hastening their death or precipitating their death. So, like many things in moral medical ethics, things will hinge. A moral agent's action hinges on intention. So the intention to alleviate pain, very appropriate, proper to give. And even though a side effect of maybe diminishing respiration, maybe even hastening death may occur, but that is not the intention. The primary objective is the good of relieving the patient's pain. We'll often talk in medical ethics about a principle of double effect, and maybe I can ask Louise if she'd like to comment on that. It's a very useful principle, that principle of double effect.
Yeah, the principle of double effect is a principle used in ethics when a situation has both a good effect, an action has both a good effect and a bad effect. And so as long as the action itself is either good or neutral, as long as the good effect is what we're intending, not the bad effect, as long as the good effect does not come from the bad effect, as long as these conditions are met, then we can do an action has both a good effect and a bad effect. And the fourth criteria is that the good effect must outweigh the bad effect. And as long so, in the case of giving morphine to relieve pain, it has a good effect of relieving pain, has a bad effect of perhaps slowing respiration, perhaps hastening death. So we have to say, is the action of giving morphine, is that good or neutral action? In this case, it's yes, that condition's met. Are we intending the bad effect of hastening death, or are we intending the good effect of relieving pain? And we're intending the good effect, so that condition is met. Is there a proportionate? Is the good proportionate or outweigh the bad effect? Is relieving pain outweighing that at the end of life we may be hastening death a little bit? And yes, that condition is met. And is it the good effect that comes from the bad effect? Is it that pain is relieved because we're hastening death? No. So that condition is also met. So in that case, the principle of double effect allows us, as a Catholic ethical principle, to administer morphine to relieve pain, even though it might slow respiration. Another thing to consider in this particular case of morphine is that the patient also builds up a tolerance. And so in order to relieve pain, you might need to increase the dose gradually as the tolerance builds. And I'm sure Dr. Traveling can speak about that too.
Yeah, no, that's absolutely right. Just the way the drug works, over a period of time, a patient may require more. Although, actually, when that happens in clinical situations, many times we recognize it may be the underlying disease process that is creating more intense pain, for which additional morphine doses need to be administered. But tolerance is part of it, and again, the intention, the objective from a medical viewpoint is caring for the patient, treating their pain, doing the right, good medicine for the patient, alleviating their pain, and sometimes that requires morphine, maybe higher doses, maybe other drugs, and so on.
Okay, you are listening to Pro-Life America Radio with our host John Williamson and our guests Louise Mitchell and Dr. John Travaline. We can't forget our tech guy Joe Morelli, where this show would never be on without him. I was blessed, really blessed, to experience my father and a friend. I accompanied them to death, and I did want to talk about that a little bit, but I first wanted to start with a question. Maybe Louise could take it first, but today we have so many, there's a group or a school of thought out there. There's people that are, I hate to say this, I don't know how I would say it, but they're taking their life. They're terminally ill, so, and they're told, maybe you have it this time, but that time, whatever, which you never really know. There was a young lady, I think, in Oregon not too long ago. She put a video out, and people had so much compassion and said that was dignified. Then a priest, a similar situation, put a video out not too long after that, why he was fighting. And I got to see a week ago an international Catholic evangelist named Chris Stefanik, Real Life Catholic, who also addressed this. So I'd like to talk about that. But I wanted to hear so how can you educate us and our listeners? It's an end of life. Louise, I think, said some good things about accompanying, the person to death and preparing them to meet their maker. I don't really thought about it like that. But so what can we tell people who maybe are I've been blessed, I really never had to experience that where I had to make a decision also. So maybe each of you could take that. How do we help people? Because there's people out there that just think it's okay and that's dignified to take the life of the person when they say, yep, I want to die or whatever. How do we, juggle that, or what do you have to say about that, Louise and Dr. John?
One of the main reasons given to help someone with physician-assisted suicide or euthanasia at the end of life is that they're in a lot of pain, and we want to put them out of their pain. As Dr. Travaline can attest, today's medicine is advanced in such a way that there's very rarely any case where someone is in so much pain that we cannot handle it with morphine or other pain medications. So that reason just kind of goes out the window. We put animals down when they're in too much pain. Human beings, we care for them, we accompany them, we treat their pain, we don't remove their life. We accompany them to the end of death, to the natural death, and we love them and care for them, and
Louise is spot on with the pain management. Many times people mistakenly, I think, feel that the only way to be rid of this such intense, agonizing pain would be to kill themselves, be assisted to do so, and that's just not true. Medicine today has the ability to deal with that.
Let me just interject. All these people that are doing this, what percent of these people are suffering from depression?
So there is studies have been done looking at that, and some have been glossed over, but that is a substantial process that underlies a lot of this. I was going to mention that some studies that have looked at, mostly from the Oregon, because of the Oregon Death with Dignity Act in late 90s, I think 97. There have been the most data looking at those people who elected to kill themselves. And when you looked at surveys and of them, obviously before they did this, and their families and friends responding to what were some of the fears that they had, it was often that they feared to be being alone, isolated, alone. They feared being a burden to their loved ones, and these were the reasons that were commonly given for them to take their life. I'd just like to comment on this particular topic in terms of, oftentimes, I always see patients who are at the end of life, and you have the sense that they just want to end it. But I call to mind something that, again, St. John Paul II wrote years ago in this declaration on euthanasia, that oftentimes when patients are in such situations of end of life and pain and suffering, their plea is for ending their suffering is often a plea for love, to be accompanied by others, not for their death. And so I think of that often, and so to the degree that patients are in those situations, as Louise noted, and we see and do, to be there with them, to accompany them, to love them at that critical moment, the period of their end of their life.
Thank you both. That helped me. But Louise said something I think really interesting about putting an animal down. We live in a society, people love their animals so much, and they're so attached to them. They treat them better than humans in some cases. And I'm wondering if maybe the mentality is people are like, well, we put down the animal, let's put down the human. I don't know, but when you said that, it kind of triggered something there.
Yeah, I think that's...
Part of it is that when someone's suffering, they figure, oh, well, the only way I have any kind of control is if I choose to end my life. But because human beings can understand suffering and pain where an animal can't, that's why we put down
Not
an
all
animal.
human beings can. Catholics, good Catholics, and we're all are here understand the value of suffering, but you're right.
Right. And so we can get meaning out of suffering where an animal can't. And to then say, well, I'm going to just end my suffering by killing myself, then you're depriving yourself of an opportunity to grow, to use suffering, to give it meaning. And that meaning is to take what pain medicine that you can manage and to have your friends around you accompanying you.
Thank you. I would like to say, John, last Wednesday, I was blessed. Chris Stefanik, who's an international Catholic evangelist, real life Catholic, he showed a video. He had a friend, this woman, she died of cancer, and she was in her 30s, I think, but she wanted this video out. And what you just said, accompanying the person to death, like maybe not the person who's dying, but maybe the loved one. Maybe it's for them. And you actually what the talk was about, you're depriving, and even if you're a single person, let's say, you might have friends or people and I got to experience that personally. I got to accompany my father. John talks about his mother, Bernie, and his mother, and I knew them both, but I got to experience my father. He died of cancer, and he wasn't quite 70, and I was there when he took his last breath, and he was a great man of faith and one of the most influential men in my life, and I got to be there. It was so peaceful. But something even more profound, a friend of mine died a year and a half ago, 51 years old, from cancer. This is a friend I went to grade school and high school with, and he asked me to bring him a priest. This was unbelievable. The priest came, he went to confession willingly, anointing of the sick, I think 2 or 3 times before he died. His family wanted us around. Not just me, there were some other friends, and the night he died, we were all there. His family, about 15 of us, family and maybe 7 or 8 friends. And I was like, is this the right thing to do? But that's what he wanted, and the priest said, which he did is really it's hard to put into words because I love my Catholicism. I helped usher him, I believe, into the loving arms of Jesus. And suppose he said, months before that, I'm terminally ill, kill me. Like, all that will be lost. So I hope I'm making sense. Maybe you can elaborate on that.
Yeah, and again, I just get back to, I think John Paul II saying that often a plea for ending their life is not a plea, in fact, for suicide, but a plea for love, to be accompanied
And it's a
with
beautiful
someone.
thing.
And it's a very insightful, as he was brilliant in these matters. And I think of that often. To your point about what we do with animals and so on, to me, now that to some extent, because I've heard it from a few people, family, patients. In particular, I'm thinking of one case where they're asking to end the loved one's life. And to me, that makes me think that there's a horrible desensitization that we have in terms of our view of life, an abiding view of human life, human dignity, that we're blending, view and not making, as Louise so many times said, how different we are from animals as rational creatures.
Why are we taking that dignity away? We could do a show on this, but it's a lack of catechesis, lack of faith, and not being formed properly in the faith and conscience.
Oh yeah, the multiple insidious nature of sin and disregard for.
Amen.
And what this also shows up in is that even though the Oregon law was the main reason that was advertised for making it law, was for people in great pain to be able to end their lives. After the bill became a law, what we're seeing is not that people who are suffering great pain want physician-assisted suicide. The main reason that people give is that they don't want to be a burden. In order for someone to feel that they're a burden, that means they're not getting the love that they need as a human being.
Right, you're taking their loved ones away from them, and they maybe want to help you,
Right.
I just had a fellow come in to me today who told me he's got 2 months to live, and I said to him, let me know what I can do for you, anything. I mean, the only thing that could make me feel good is if I could do something for him.
Mm-hmm.
And but I want to clear a couple things up. Number one, my father never complained of pain. Okay, just I'm so tired, is what he said. My father died. He had 6 of his 8 children around his bed, and his wife was holding his hand, and one of his sons was on his way back from church, trying to get back there, and it was just a beautiful way to die, I thought. And with my mother, this similar thing. She had at least 4 of her children around her bed saying the rosary, as she died. I thought it was a beautiful way to go. But a question I have: when my mother was sick, and she was sick, on and off for 2 years, you had about 50 different doctors treating her. Either her GP, the doctor in the hospital, the specialist in the hospital, every time she went in, and you got 50 different opinions as to what she should do or what she shouldn't do. And we heard Mr. John Ferry Jr. talk about his father's death, and what is the duty of these doctors when you are dying or you're sick? My thought was that they all want to get their own opinion in. They want the patient to do what they think they should be doing morally. And what is the duty of a doctor when they have a patient to bring out his point of view as to how you should die or whether you should be treating or not? What can you give me an answer there?
Well, a physician ought to care compassionately, sensitivity, with love, and in truth, with their patient. And every doctor ought to do that. Today, particularly in westernized medicine in certain areas with hyper-specialization, there's been a loss, I dare say, and I think we recognize that loss in the compassionate demeanor that many doctors once had for their patient because of a number of factors, a number of barriers that exist.
Insurance and lawyers.
Insurance, right? Time constraints.
How about lawyers?
John, you're a lawyer. I'd like to say anything about that, but there are enough other barriers before we get to that. But so there's been an erosion in compassionate care and love for patients. This was a big part of why we came out with this book. That was the genesis of this book was looking at Catholic physicians who we knew were faithful Catholic in their practice, that that still had very much as part of their ethos compassionate care for their patients, and wanted to put that out there for people to showcase, if you will, what good care might look like or does look like. The subtitle for our book is Practicing Medicine in Truth and Love. I just mentioned truth a moment ago. Once we know truth, or as we come to experience truth, we're then equipped to love appropriately as we are ordered to do. So this is the answer I would give you for this.
Hi, this is Bernie Long. I'd like to ask you, it's a very Catholic show. You're talking about the Jesuits and the Augustinians and Dominicans. But there's a lot of people say, well, what's that have to do with me? I'm not a believer. And we have a culture now that I think is going more and more to assisted suicide. And they would say, don't I have a right in my own life to decide how I'm going to die? And I think another thing is that the Terry Schiavo case, it seemed like they didn't let her die, they caused her to die by not giving her water. But so what do you say, because I have a friend who's an atheist who listens in, what do you say as a doctor? You take an oath not to do any harm. Can you make an argument without no popes, no saints, no Catholic doctrine? Why should the government say assisted suicide is wrong?
Well, Bernie, thanks for that question. Louise and I just also co-authored with two other prominent ethicist physicians on the issue of physician-assisted suicide and euthanasia. And we authored this paper. The background to this article was, how do we argue against those evil acts, I don't dare say, those evil acts of physician-assisted suicide and euthanasia. And our argument was from a non-religious based, we said a non-theistic based argument. And part of that, without getting into detail, I'll let Louise comment as she likes also, but part of that is an appeal to, and I hesitate to say, natural law and truth. Truth is truth. So an appeal to what is true, the transcendental truth, what is good, right? And we do that, we did that, we touched on that in this paper, to argue that, take God out of it, if you will, take popes out of it, what they've said, and just on the basis of what's good, true, what's beautiful, those transcend.
What about the oath you take as a doctor, Hippocratic oath? Do you think that fits into to do no harm? To give a patient administer them a drug that would take their lives or end their life?
No, and that's well. First of all, many medical schools now are not subscribing to oaths. Okay,
oh no, right.
And
or the students write their own oaths.
Really?
So every doctor is going to have a different thing that they're swore to.
And that wasn't in the past. It was only one oath. Am I right?
Yes, the Hippocratic oath.
Right.
Correct.
So they don't do that anymore. I didn't know that.
Correct.
Yeah.
Right. Very few.
I think we've got a call coming in. Does any of our listeners have a question?
Yes, I would just, how you doing? I just would like to ask your guest for the name of the book again and where we can find it.
Oh, that's easy. Catholic Witness in Healthcare, Practicing Medicine in Truth and Love by Dr. John Travaline and Louise A. Mitchell. Where can we get that book,
It's
Louise?
on Amazon, at Barnes & Noble. You can also go to the Catholic Medical Association bookstore and get it there. That's cathmed.org.
What does it cost?
$45.
Looks like my wife's going to be spending $45 tonight. Do you have any other questions, ma'am?
No, thank you. But thank you guys for the information you're sharing. Appreciate it.
You read my mind, young lady. Thank you very much. Okay, well, there's one issue that I would like to address, Doctor and Louise, and that question is the greatest abortion provider in the history of Delaware County. 60,000 dead babies coming out of Crozier Chester Medical Center. They have performed these abortions on their grounds, and they also rent space to an abortion clinic, and as far as I know, that abortion clinic is still operating. 60,000 children A few years ago, they contacted St. Kevin's School or St. Kevin's Parish in Delaware County, and they asked to rent space there. What do you think about that? Do you think that the Catholic Church, the Catholic school at St. Kevin's, should or should not be renting space to the greatest abortion provider in the history of Delaware County? I think the doctor should answer that first.
Oh. Well, it brings up the issue of cooperation in moral theology. We talk about material and cooperation with evil, formal cooperation with evil, and let's think. There are many instances where very good moral, the church as an institution has dealings with businesses and other companies and operations that may be engaged in very immoral activity. This example of St. Kevin's leasing space to a hospital system who does abortions,
leasing space for a different purpose.
Right, leasing space for a purpose that isn't, I was going to say, for the performance of this immoral action, is, I think, morally okay. It's not the St. Kevin's is not intending that they do abortions. They're not involved in any way with that evil action.
And the abortions are not being performed on St. Kevin's property, nor are they being promoted. It's apparently a daycare center for the elderly.
Or something like that. But how about a guy like me who walks out of St. Kevin's Church, goes to the 4 o'clock Mass on Saturday afternoon, and walks out and sees a sign, Crozier Chester Medical Center, on the grounds of St. Kevin's, and I know that they've killed 60,000 babies.
So you may get into the concern for scandal, and so it may be scandalous or probe that area that St. Kevin's has some kind of sign display this operation.
Right.
You also mentioned that Crozier Chester has sworn that they will abide by all the Catholic guidelines.
Right.
For that facility.
When the Catholic Church got involved with renting this space, one of the bishop's chief priests told me that St. Kevin's has agreed to abide by the Catholic Church rules as far as the elderly people that they take care of. But my big issue was.
So it's a teaching opportunity then for us to teach Crozier Chester proper way to respect life.
Yeah. Well, what I would have done, I would have put in the lease that they can have the property, they can use it, but don't do any more abortions anywhere in their hospital. Okay. I think we're winding down. Joe, are we running out of time here? Okay. Well, I'd like to thank our 2 wonderful guests tonight, Dr. John M. Travaline and Louise A. Mitchell. But the most important thing is to get their book, Catholic Witness in Healthcare. You have got one sale tonight because there's going to be $45 coming out of my account because my wife will be buying that book, I guarantee you. So that's a great book, and in fact, I was very interested in when I saw the content of that book. I'd be very interested in it. But anyway, John and Louise, thank you very much. You've been great guests. The hour is up, and now we've got to close our show. So our pledge of recommitment. I thank God today for the gift of my life and for the lives of my brothers and sisters. I know I am responsible for the unborn who cannot speak for themselves. I know the most serious tragedy of our day is a tragedy of abortion. Today, I commit myself never to be silent, never to be passive, never to be forgetful of the unborn. I commit myself to be active in the pro-life movement and never to stop defending life until all my brothers and sisters are protected and our nation once again becomes a nation with liberty and justice, not just for some, but for all. Amen. So pray in front of an abortion clinic, educate yourself, educate others, vote, and be charitable. God bless us everyone, born and unborn. This is Pro-Life America Radio and John Williamson saying goodbye for Charlie DeFeo, Bernie Long, and John Ferry Jr. in the studio tonight. See you next week.